Hello, CAM followers. It is lovely to see you on this Thursday night. I have the wonderful Dr. Gwen Covey-Crump with me tonight. She has been here many times before, sharing her amazing knowledge with you guys. Tonight's topic is going to be quite a punchy one. We definitely notice with our online work that a lot of people are looking for alternative ways to manage arthritis. Rising costs, the economy crisis, people are looking elsewhere of how to medicate and control pain. So hopefully tonight's live is going to be extremely useful to you guys to make you understand why we're really, really hesitant about you doing that. But we're going to have a big overview. We're going to talk about pain. We're going to be talking about consultations. We're going to be talking about what your vet care can provide. And we're going to go through some medications that are commonly, and I'm going to say the word, abused, and explain to you why we're really in fear of you doing that. And we're hopefully going to give you 10 top tips at the end that are going to replace them. So before I let Gwen introduce herself, I am just going to do a blatant plug about our lovely booklet, Why Don't You Listen? I'll just turn the music down here. So this is an illustrated children's book. It is written by us at CAM, it's illustrated by one of our followers, and it is designed to help you as a family understand how dogs express pain. Because believe it or not, pain is one of the leading causes of deleterious negative behavior change, i.e. confrontation, bites, those sort of things. And as a vet, first opinion vet, I've put many, many dogs to sleep that the families have lost faith with because of incidents like that. And when you look back, there probably was an underlying reason that that dog's behavior changed and that incident happened. And we don't want that to happen anymore. So the book is available from the CAM shop. I want every primary school in the UK and in the world to have it. We want every library to have it. And we really want a pharmaceutical company to go, yes, we want it to, and it should go out with every prescription of any medication. So please do go and have a look at the booklet. I'm sure one of the CAM advocates, one of the CAM ambassadors will put a link in the feed beside us. Now, Gwen, tell us about yourself so everybody has faith in what you say.
I'm Gwen. I am a veterinary specialist. So I specialise in anaesthesia and analgesia, so anaesthesia and pain management. And I work at Langford Vets, and then I also do other professional stuff like this, supporting CAM and various other things like that. So I run a pain clinic as part of my practice, 1 day a week, where I can see animals, mostly dogs and cats, the odd rabbit, into the pain clinic, where I work alongside a physio to just look at what we can do for that dog. And then we come to a treatment plan, and then we will sort of, I guess, rehab the dog, I guess you could describe. And then we will effectively hand you back to your primary vet and your local physio, etc., to, have the ongoing care long term, so that you don't have to live near Somerset to access this sort of treatment. And there are a few other pain clinics around the country, but there are not many that have an active physio working alongside a specialist. So that's the way I like to work. And then the rest of the time, when I'm at work, I'm an anaesthetist.
Yes, which also involves huge amounts of pain management for all of the we do.
Well, it is interesting because people are coming to me all the time, specifically finding me at this massive anaesthesia team we've got, saying, can we talk about this chronic pain case? It's like, I need to be an anaesthetist right now. I need to concentrate on my patient. Maybe I'll catch you later.
Yeah. But the chronic pain discipline is growing massively, isn't it? And I think we're beginning to realize that there is a serious iceberg that we need to be dealing with, and we're only just touching the tip of it. And work that's now coming out from universities in America, like NC State, is showing us that chronic pain conditions are being experienced at a lot younger ages. And how outrageous it is to say, but I think owners with younger dogs that have chronic pain conditions are really, really focused at trying to manage it long term, and they'll look at all different angles to do so. And I think that's really driving improvements, So it's an extremely exciting time. So our topic tonight, hopefully it's going to be quite casual. We're going to not be too formal and no, but we're hopefully going to explain to you why your first opinion vet will be really hesitant about you exploring medications that you may have at home. So I'm going to use my agenda today, guys, so I might look down a little bit. So we've mentioned that it is in the news at the moment. I did a little bit of a Google search and it comes up in a lot of newspaper articles, a lot of magazine articles, and it's got a scary title, How to Manage Your Dog on the Cheap. And you're like, oh, and there's things like this, and you hear lots and lots of these like non-veterinary advice. So what we're going to try and do is keep it evidence-based, clinically based. Okay. Our first thing is we would like to just remind you guys the benefits of going to the vet clinic. And we're just going to have a little back and forth of what you can get out of being at the vet clinic. It isn't just about the prescription that you're going to take away. So I'm going to start the ball rolling and say, when you come into the vet clinic, you're going to have an array of other services available. The weighing scales, the nurses available, other veterinary members of the team. You've got the diagnostic facilities available. You've got blood screening available. It's there to be used. Another thing I want to add to that as well is that we're talking about arthritis, but many of the dogs in this age category have comorbidities. So Gwen, explain what I'm trying to get at about this.
Comorbidities. So other things, I guess typically a lot of dogs with arthritis are a bit older, and with age comes an increased prevalence of other age-related diseases. I guess the longer you live, the more chance you have of having another disease, and these are often coexisting with arthritis, and they can be exacerbating arthritis. So sometimes, Hannah and I classically share stories where a flare-up of arthritis, you think it's just a flare-up of arthritis, it actually turns out to be something else that needs treating and potentially, quite serious left untreated. So that's what Hannah means by comorbidities. Is that what you wanted me to explain, Hannah?
Yeah, absolutely. And so I've got a slide that I often use in lectures, and I talk about all the cases that I've seen, well, not all of them, but some really key points. I had a dog that we assumed was acute flare, and actually it was hypothyroid. I had a dog that was an acute flare, and it was bone cancer. I had a dog with an acute flare, and it was a splenic tumor. I had a dog with an acute flare, and it was libramide toxicity. And all of these dogs, if it had been just a telephone consultation, or if they'd just exchanged a conversation with their mate in the park, would have had their pain meds ramped up, and they would have been totally missing the point of what was causing that deterioration. And I think it's really easy for people to believe and perceive that a dog will have one condition that they deal with at any one point. And it's not so. We often have dogs that might be cushingoid, arthritic, with atopic dermatitis. They've got ear disease, dental disease, and a heart murmur. And, it is really important that people understand that when they go in for that vet visit, we're looking at a bigger picture. We're looking for clues that it might be something else.
Your vet is a general practitioner. They're looking at the whole animal, not just the thing that you've taken the dog in for.
Yeah, 100%. So when your dog is having an acute flare, unless you're very experienced and you've actually had that dog for years and you've worked really well with your vet team and you've got it down pat, your objective monitoring's great, you suddenly see the ears go back, the back arches, the tail drops, you know that your dog is having a flare because 3 days before you walked a bit too far or you jumped out the car. If it's quite a new experience, please do get them checked out because it could be something completely different. Back to the veterinary environment. What other things in that visit to the vets do you think that owners will get as well that warrant going to the vet practice?
I think just masses of advice. So, I think your vet's got a whole load of advice they can give you, and also other members of the practice, the vet nurses and the receptionist. So, I think you can go in there with lots of questions and get lots of answers. Sometimes we open up more questions. But mostly what you'll find is that the vet or the vet nurse will know where to look up the answer or to find out more for you. And, you know, follow up things you're interested in exploring. I just had a consult today where the client was really interested in exploring what joint medications specifically, you know, that we could inject intra-articular. She had a particular thing she wanted me to treat her dog with. So I said, hey, I'm going to go and look that up. I'm going to come back to you with more specific evidence-based advice on that and tell you what I think about it. And so, you know, she was really happy with that, because she came with the idea, and then, you know, I'm going to come back with my further opinion, and hopefully the solution, you know, we'll find together.
Yeah, and from my first opinion world, I'm just envisaging the owner coming in front door. There's immediately the weighing scales, and this is probably one of my biggest conflicts with managing chronic pain is weight. And it's such a taboo subject. Owners find it quite difficult. Vets find it a difficult topic, especially if the dog has carried that weight for years, and you really need to get them to start shifting it, because we've got chronic musculoskeletal pain. The weighing scales are there. You know, who has weighing scales at home like you do at the vets? You know, so that's one thing. Another thing that I pick up probably once a day, long claws.
Oh, yeah.
And I see, and people come in and they're like, oh, yeah, he's not doing so well. I'm like, let's get these claws sorted. Let's get the fur sorted. We had Hamish in the other day, a Westie, and he's got the really splayed toes now. He's been overloading the front limbs. He's got his Queen Anne legs. And the skin from between the pads, the interdigital skin, is now in contact with the ground. And his deterioration in lameness isn't his elbows. His skin's bad. I had a dog the other day came to ask about elbow medication. So come from another practice, wanted to know whether they could do stem cells artemis. Looked at the dog's feet, atopic dermatitis flaring.
Let's sort that out before we start doing fancy procedures.
Exactly. And, you know, I quite like doing the full, I love doing the full check over, going, actually, isn't this great? It's not a flare, it's something else. We can do something about that. And I've even had dogs that have had reasonably controlled pain, and they've then had maybe an ear infection, and that's made the dog very depressed, low, you know, not coping. And they've assumed it was joint related, but actually is dental disease.
Painful.
So yeah, it's really, really important that people push back the blinkers and actually think, is this definitely arthritis related? And if it is it a specific joint? Can we do more about it? So that's me finishing. Please do not see that your vet is just literally in the door. Here's the meds, goodbye. You're going to get so much more out of going. So please take advantage of it. Now I'm going to push this over to Gwen. A quick reminder about pain processing, with the intention of highlighting how complex pain assessment, prescription and response to treatment, as well as checking no contraindications, comorbidities, how one size does not fit all. So can we just talk about the pain pathway and how actually it's quite complex, and by visiting your vet, they're going to be able to assess whether a different type of medication is going to be needed, rather than just throwing another anti-inflammatory at them. Can you explain that?
How long have you got?
Oh, well, I'm going to give you 5 minutes.
Okay, so I think, well, we're all familiar with the concept of pain. If you injure yourself, pain is an emergency signal basically to get you out of danger, yeah? So it's useful, and this is what we call adaptive pain, and it's acute. It's quick in onset. There's often an injury associated with it, and it goes away when the healing occurs. Now, what happens with chronic pain is we're looking at when there's been the classic that we're talking about is arthritis. This is inflammation, which causes those signals that go to the central nervous system. Over a long period of time, what we start to see is the way that the signals coming from that arthritic joint, for example, is the way those signals are being processed by the central nervous system, and ultimately it's perceived in the brain, and that's when it becomes painful. And then we can call this pathological pain or maladaptive pain. So actually the pain processing system does actually come a little bit abnormal and can actually end up amplifying pain. So where you've got a relatively small stimulus, it can seem much more significant to the dog. So that might be how chronic inflammatory pain or chronic arthritis pain is working. And then we might have other aspects of pain, so such as neuropathic pain, for example. You may have heard of neuropathic pain, which is technically to do with injury or disease of nerves, but also is related to a dysfunction of the way the central nervous system is processing pain ultimately. So, but if we know it's related more to nerves, primarily, an example would be arthritis of the spine causing pinching of nerves, then we've got several types of pain going on. So we've got the pain related to some arthritis in the joints of the spine. We might also have some neuropathic pain because the nerves that come from the limbs are maybe being irritated by the changes that are going on in the spine. So we need to treat it from several angles. So in the classic treatment we use a lot of, and most of you are familiar with, is an anti-inflammatory. That's very good for inflammatory pain, unsurprisingly. But some of the more chronic aspects of pain are better treated with some other drugs, which specifically will treat the way pain is being processed in the central nervous system, or specifically treat that nerve-related pain. So not anti-inflammatories are not suitable for everything. Gabapentin is not suitable for everything. So vets will actually specifically choose the drug according to the type of pain that they think your dog has. Is that a reasonable synopsis?
No, it's great.
Much more could be said.
It's so much more. But I think a lot of people believe it's just like the pain is within the joint and you're just quelling the fire. So it's always going to be an anti-inflammatory. And I think if people realize that there are many different medications that can be used, they'll be more inclined to explore what the vet can say and what the vet can advise them. And if you remember that pain is actually in the brain and the disease is in the joint, you've got a hell of a long journey that you can interfere with different medications. So,
and it's not just medicines either, because what I didn't mention there is quite often this chronic pain is associated with changes in gait and the way a patient moves and uses its limbs, and that can result in muscular pain and myofascial pain. And that actually medication is not very good at treating. And so we need to look at things, where we get physiotherapists involved, and then other treatments. And then obviously we will at some point talk about all the lifestyle adaptations as well, won't we?
Oh yes, because it's my favorite topic. But no, absolutely. And I just want people to stop thinking there's one tier of tools. There's many tools. And by speaking to somebody that has the experience to go, I'm feeling your dog, this isn't actually the joint so much. The joints, as it was, still sore, but wow, look at your dog's back. Look at what you do when you palpate around the neck. This is something else, and we need to approach it differently. So do not get into the habit of going just around the dog park and somebody said, oh, just whack up his non-steroidals. Give him double dose. Yeah, I've got some in my drawer. I'll lend you. Because actually, it might not be what your dog needs at all. Arthritis. When I started, Cam, I thought I might actually learn and be good at something and know one thing really well. And the more I know about it, the more I realize it's so complicated. There's so much you need to know to manage it well. And that's what your vet can do for you. Okay, so we've done the pain processing. Now, let's look at the array of medications that are now within the toolbox, give some indication of the clinical efficacy, and hint at the complex clinical trials performed to get us this. So this is where we're going to talk about, we've got our non-steroidals, we've got our COX-2 selective, we've got our piprants, we've got our monoclonal antibodies. And then we've got our gabapentins, we've got our pregabalins, our memantis. Help us just do a little bit. Maybe let's talk about a case, okay? And then people can understand where this all fits in. So you've got, let's do this, 10-year-old golden retriever carrying a bit of weight, real waistline sway. Those hips don't really go forward. The waist goes forward. And the dog flobs to the ground and pants. And the owner says to you, he's just so depressed. He just doesn't like going for walks anymore. And do you know what? I went to touch him on his lower back the other day. He turned around to try and snap me. Let your brain go wild on that, so people can understand that there's so many different things that you're thinking of bringing into this treatment plan, not just next door neighbours non-steroidal. Go for it.
Is the dog already on any meds?
No, completely fresh.
No meds at all. All right. Well, the thing I find often with a dog like that is you can't see the wood for the trees when you try to examine it. So I think I want to get some idea of where the problem is. Like, is it in his elbow? Is it in his knee? Is it in his back? But actually, everything hurts, or at least the dog behaves as if everything hurts, and it's almost impossible to work out where the worst problem is. So I've got to spend a lot of time questioning the owner on what's gone before. It's suddenly got worse. Clearly, the dog has been brought to you in the surgery, and this is not new. This has been going on a while. So you need to start quizzing, find out what's going on before. Have they had any friends that have noticed any changes? Have they noticed any lameness that might help you narrow down the primary problem, the initial problem? But what I want to do right now is just get that dog's state of central sensitization, that amplified pain, which is way beyond proportion, down, so then we can see the wood for the trees. So I'm classically going to want to put this dog on an anti-inflammatory medication, but I do want to know first if it's got any other problems, health problems, so kidney or liver issues, for example. It's really hard to just plonk an animal straight onto a non-steroidal without any prior information. So usually I think I would start with a short treatment with a non-steroidal anti-inflammatory and see the animal straight back within a few days, just check how it's getting on, and to extend that treatment and possibly do some blood tests and things that would be ideal to get the sort of baseline knowledge of what's going on with the dog's system, that we've not got any contraindications to anti-inflammatories. I will frequently, most animals come to me, they are already on treatment, and I'm adding something else. So we don't have a lot of licensed drugs in the veterinary world that are anything other than anti-inflammatory. Yeah. You agree? We've got a few coming into the market. So we've got some different types of analgesics. So we've got some injectables, and we've got licensed drugs like tramadol and things like that. But we don't have any of the drugs that I think really get that pain amplification down. I mean, the anti-inflammatories themselves, when they're used for an extended period of time, are going to get that pain amplification down. And Helen, are you still with me? I just lost my screen. Yes. Everything just went black. So I think the first thing would be an extended course of anti-inflammatories once I've established that it's safe to give that extended course of anti-inflammatories. And then I might add in an adjunctive drug to that, which is usually going to be a human medication. It's not licensed for veterinary use, but we do have a lot of experience with. If I've not found a specific nerve pain in that dog, I'm probably going to start out with a drug like amantadine, which some of you may have heard of, or its sister drug called memantine, as a first line from my perspective. there's loads of other options, but with the dog that's this apparently severely affected, then that would be what I would start with. But I also want to be checking there aren't other things going on. And I think the classic that Hannah mentioned was a hypothyroidism. That's so much on the agenda at the moment. I've had so many patients that has been a problem.
Yeah, absolutely. And I was also thinking splenic tumor.
Yeah. So I've had one of those as well with patient that came in really unwell, and so the first thing your vet's going to do is an examination of the chest, the heart, the lungs, and feel the pulse and things like that. And this dog had a really rapid pulse rate, and she was pale, and all the indications to me were that actually she was bleeding internally. We actually got her operated on as an emergency, and it was a splenic tumor that was bleeding. So I think that's the point. The vet's going to examine the dog and look for other options. But I guess my point there is, when it's pain that is the problem, it can be really hard to tell where the problem is initially. So it's not a one, okay, have these pills and go away. I need to see your dog back to see how he's getting on with that treatment, and then we might need to refine the treatment. We might need to add something in. And also I want to check that your dog's tolerating the treatment okay.
Yeah, no, absolutely. And I think that's a really big key to it. Can you hear the ducklings? Sorry.
Yeah, I was wondering which of your menagerie that was.
Just woken up there. So sorry. No, the case example, you hit the nail on the head. You need owners to expect that this is peeling an onion. First layer, second layer, third layer. And going in and having all the answers on day one is actually going to be really unlikely. Because if a dog is that uncomfortable, yanking them around, going, I think the primary is in the elbow. The dog's going, everything hurts. So actually getting that pain state down and then saying, let's have another look. Where are we at? Okay, I can do a little bit more. The dog is not so reactive everywhere. I'm beginning to pinpoint where our primary sources are. So please, owners, do expect that it might be multiple visits. And then with that one, I was fishing whether you were going to do an anti-inflammatory and, as you say, a drug that's more designed to try and control that amplification, which is brilliant what you said. And there's others in that category. But say that dog came back again and it been on an anti-inflammatory, it being on a amantadine product, and the dog's spirit was still stupidly low, but when you're palpating them, actually it should be getting better. We've got medications we can bring in then as well. So multiple visits is really to be expected. And I'm going to use a really good case example that is happening now. It's called Jack Hurd. I've been seeing him for ages. And my heart's been bleeding over this one because he's been so difficult. But today I had an ultimate wonderful thing happen. The last time I'd seen him, he'd been on Labrello. He'd been on Meloxicam with consent because it was long term. You should only use it for 2 weeks together. Had also been on memantine. Had also been on paracetamol. And had pregabalin for bedtime. Had laser. Had acupuncture. Jesus. And the last time I saw him last week, things were looking good. Always had very bad cervical pain, like really awful. And also allodynia down the forelips. Every time I brush your hands down, I was like, ah! And we'd brought pregabalin in at twice a day, and he was, so we cut it down to once a day, and it's not too bad. Today, I saw Jack Hurd, and he has no longer is he on paracetamol or meloxicam. He is literally on Labrello, memantine, and pregabalin at night. Palpated all over him, didn't flinch, smiled the whole time. He actually came in happy, and I was like, wow, this has been quite a lot of time that we've been working, trying to find what is going to work for him. There's been lifestyle adaptation, there's been weight control, there's been adding a harness, there's been making sure that rugs are down, exercises, back legs, trying to get some strength back in them, massage around the neck. We have done everything and we have got there. So that's just to tell you guys, it can be quite a long journey.
Yeah.
There's lots of different things that you can be adding. All right. So now let's crack on with common scenarios and temptations. Number 1, friends, dogs, meds. What's all this about? Because we hear it all the time, don't we?
Yeah.
What's the classic?
Sorry. Yeah. So, seriously, I think it's quite common for a dog owner to be left with a load of medication after their poor dog is put to sleep, for example, and they want to make use. They don't want to waste that medication. You can't take it back to your vets. They're not allowed to take it back into their pharmacy. Well, they will destroy it for you, but they can't put it back in the pharmacy. And the temptation is to give it to a friend. Now, I guess one could say if that friend's dog is prescribed exactly the same drug at exactly the same dose, what's the harm in that? But the first thing I would say is their vet doesn't know they've been given this, extra load of, meloxicam, for example. I'm not going to pin the blame on any one non-steroidal, but that's it seems to be very commonly prescribed one. Their vet doesn't know they've got this extra supply. So there's always that risk that then maybe they're not going to go back for the checkup in the period of time their vet's expecting. So that might be that's sort of the most innocent loan of meds. Mm-hmm. But what's more common is that medication is loaned to somebody to help them out because they think their dog is uncomfortable. So I've just had this week a dog in the hospital that was given Metacam, on top of another non-steroidal. I can't remember which one. So they were giving 2 non-steroidals at once, different names. In fact, I know what it was. Metacam at the same time as Loxicon.
Oh.
It's the same drug. So the dog was being double dosed, and it was in the hospital because it was being stabilized after a gastric bleed.
Yeah. I've seen that.
A fairly innocent mistake, but it's because they'd got a supply of medication from a friend. So that's probably a good example. And then the other thing is, if you're starting on an anti-inflammatory, your vet will check your dog out, make sure it's safe to give them an anti-inflammatory. They are not completely innocuous drugs, as we all know. And you do hear horror stories. They are rare, but they're much more likely to happen if you medicate your dog with prescription medicines without seeing the vet about it first.
Yeah. And I think it's not the public's fault at all, because you kind of... I've just recently went to America, by the way, just so you know.
Oh, you can buy anything.
Just drop that in there. But I went to what they call a drugstore, which is just a supermarket, isn't it?
Yeah.
And the aisles and aisles of medications, vitamins, supplements, you name it. And you look at that and you just think, wow, it's so freely available. Some of it, as you say, more innocuous, more supplement based. Others seeming to have a little bit more of a medicinal vibe to it. And when you have that concept that it's so free and easy to get as a human, I think you can take that attitude into medicating your own dog. And that slight, complacency. But I'm going to say it, I'm so proud. I love drugs. I think they're amazing. Drugs are amazing. They make my life so much easier as a vet. But I choose them correctly, and I make sure the dog is in a suitable state to the best of my ability prior to prescribing. So please see value in making sure that your dog doesn't have a condition such as inflammatory bowel disease, or it could be harboring an underlying neoplastic cancerous condition, and you then whop in with a non-steroidal. It's not ideal at all. So do not be tempted. Do speak to your vet first. Some vets might even be able to give you very brief advice and go, yeah, no, that's fine. But don't just do it free willy, okay?
Yeah.
Right. The next most common one, paracetamol. It's everywhere. So we've got a bit of a blanket ban in Holly's Army where we really discourage people sharing dose rates. And the reason we have this blanket ban is because, A, we're not allowed. We'll get proper smacked. But also we want you to talk to your vet. We want you to talk to your vet. And it might be that you can phone up your vet and say, look, Loki, he's already on Metacam. He's on this the other. You saw him 3 days ago. He's having a downturn. I've been thinking about paracetamol. What do you think? It might be a telephone conversation or it might be a visit, but we need you to check in with your vet. So tell us about paracetamol.
Okay, so paracetamol is available for humans over the counter. And that is, so the Human Medicines Regulation Authority, I think that's what they're called, have made the decision that it's, a safe medication for people at the set dose that is on the packet. And we do know that paracetamol is also really useful for dogs. And we also have our idea of what is a safe dose for paracetamol for dogs. And I say idea because we've not actually done tests specifically to know exactly what dose is safe. So what we do know is that we do see poisonings every year of paracetamol. And because dogs do have, the dog has got to metabolize paracetamol via the liver, and then it has to come out, be rid from the body, and it's very liver toxic when it goes above a certain dose, which is actually not hugely different from a high therapeutic dose. And it can cause a lot of damage to the liver, but it's very insidious, so you don't see the problem straight away. It's not licensed over the counter for dogs, except for the preparation called Pard LV that is allowed to be dispensed by a pharmacist or a veterinary nurse or a vet, because it's a drug that's called that's prescription only medicine dispensed by vet or suitably qualified person. I can't remember the exact wording, but if you go to a pharmacy and ask for paracetamol for your dog, all they're allowed to give you is Pard LV. They're not allowed to give you they're not allowed to give you human preparation of paracetamol, because they do not have training in veterinary prescribing beyond that specific formulation they're allowed to give. So but obviously you can just buy it off the supermarket shelf, so the temptation to just give your dog paracetamol is very high. But and the poisonings we tend to see, they're usually when the dog has accidentally ingested a whole load, but over time just giving your dog what you think is an appropriate dose can cause liver toxicity.
On the other side of the coin is that we know that it's not the best kind of way to manage peripheral inflammation.
So it's not an anti-inflammatory in the way that these prescribed non-steroidal anti-inflammatories are. It's really an anti-inflammatory for the central nervous system, which is why it's quite good, seems to be quite good for things like headaches and for reducing fever. But not so much for it, it's not going to reduce swelling in the joints and things like that. So it's useful in a combination therapy, but it's not going to have a huge influence from an osteoarthritis point of view on its own.
Which actually answers this question. So I am looking at questions. Nicola, you're talking about your dog being on paracetamol twice daily, but being unsettled at night. It's not commonly used on its own for osteoarthritis. So I think what would be really good is to go back to your vet and actually say, right, let's really, really relook at this whole management plan. Am I on the right primary foundational medication? So before adding stuff like evening, to have a chat with your vet.
The other thing that's worth saying is maybe have a chat with your vet about the frequency of dosing, because actually we know paracetamol is quite short acting. And it might be that twice a day is not enough, but you need to speak to your vet about the appropriate dosing interval as well. So it might be that it's actually giving him some pain relief, but it's running out overnight because it's quite short acting.
Yeah, absolutely. So yes, paracetamol commonly used, but like any medication, like anything, if it's used inappropriately, it can either not work and be a complete waste, and the dog is left in pain, and you're popping the pills going, it's all right, it's got paracetamol on, and he's still going, doesn't touch the sides, mate. Or you might find that actually you're risking toxicity. So please speak to your vet about that one. Right, next one, ibuprofen.
I've also had one of those recently. Ibuprofen given on top of a prescribed anti-inflammatory. So dog was already on a prescribed anti-inflammatory with their vet, and it was a bit uncomfortable, and the owner decided to give some ibuprofen as well. Now they are the same class of drug, so we don't give, so effectively you're double dosing. That's the first problem. The second problem is ibuprofen, again, it's available over the counter for people because we know a lot about the way it's metabolized in people, and we've judged what a safe dose is, and it's quite a low dose that is on the packet, and doctors can prescribe much higher doses of ibuprofen for people. But my point being that the low dose is what you can get over the counter. The problem is dogs metabolize ibuprofen slightly differently to people, and in different proportions. So some of the metabolites of ibuprofen, they are transformed by the liver and then excreted into the bile, and the bile goes into the intestines, and then it goes on down the intestinal tract into the large bowel, where it's reabsorbed and then does this thing called intrahepatic circulation. So that drug keeps getting reabsorbed and keeps exposing the liver and the kidneys to more of this anti-inflammatory drug, which ultimately becomes toxic, and it sort of builds up in the system. So it's due to the fact that the dog metabolizes it slightly differently to people, which what makes it toxic. So most commonly, the causes of poisoning are because the dog has eaten a whole packet, because they're often sugar coated. But actually, we also see poisonings related to even every other dosing of what would be considered an appropriate dose. And then there's the double dosing, the giving it in addition to the anti-inflammatory that's being prescribed. I think the other thing that I worry about is that you can buy formulations of things like infant pain relief formula, which are paracetamol. And then you can buy very similar looking ones, which are actually ibuprofen. And so it's quite easy to pick up the wrong packet and then dose your dog with ibuprofen instead of paracetamol. So you have to be aware that it can sometimes be in what I call polypharmacy preparations that are available off the supermarket shelf. So you need to check apart from the fact I don't want you medicating your dog with drugs from the supermarket shelf, you need to know what's in that packet.
Yeah, definitely. Okay, next one that we hear every now and then is gabapentin, because it's a reasonably regularly prescribed human preparation. And people may have some laying around. What's your fears of this?
Well, the first thing to say, and here's me on my soapbox, it's a controlled drug, legally controlled. It's illegal to give it to somebody else. If it's prescribed to you, you may not give it to anyone else. And so, it's also illegal to give it to your dog without a veterinary prescription, particularly because it's a controlled drug, but because it's a prescription-only medicine and your vet must prescribe it. I think the issue is it's becoming so common. You're saying it's commonly prescribed in people. I think it's even more commonly prescribed in dogs, and I think I've friends who are doctors who are shocked with the number of friends they have with dogs that are on gabapentin. So I think we've sort of taken off a little bit and maybe taken it a little bit far in using gabapentin. It is a very useful adjunct, but I think we're using it a little bit casually, and I think this then starts to translate into people dog owners thinking that it is an innocuous drug that can just be shared around between dogs. We would prescribe it usually for nerve type pain. Traditionally, it's an anticonvulsant. That's what it was developed for. But there are elements of nerve pain that creep in with this chronic pain, maladaptive pain that I described. So we do use it in osteoarthritis as a when we're using more than one drug to treat the pain. It's also a sedative, It doesn't have a huge amount of interactions. As prescribed drugs go, it's pretty safe on this kind of mixing point of view, but it has additive sedation with other types of drugs. Your vet needs to know your dog's taking it if they're going to start any other drugs. What else to say? So some of the things I see.
I think a completely different angle as well is I've seen people that have home medicated and the dog has deteriorated in their eyes, and they've brought forward the thought that euthanasia is needed. And when you dig down, you realise that they've either been double dosing or adding something you didn't know about. And the dog's wobbly and lethargic and sorry for themselves because they're affected by this new medication. And gabapentin would be classic for that.
Yeah, I see that a lot. So it does make them more ataxic, especially when you first start it. And I've seen a number of animals that have deteriorated or appeared to deteriorate after starting gabapentin, and it was put down to the dog getting worse rather than the medication actually being too high dose for them. And I guess the other thing is it works most effectively if it's dosed at appropriate intervals. And so, you might not be using it at an appropriate dosing interval for your pet.
So there you go. Please, guys, don't just kind of grab any of the gabapentinoids. We tend to introduce them pretty slow and low and titrate them up. And some dogs don't tolerate them. I'm reasonably frequently saying, this isn't the best choice for your dog. Let's think outside the box. This isn't the one. Next one, Naproxen. Now I know nothing about this. Over to you.
Naproxen is another. Can you get that over the counter for people now?
I do. I think people just have playing around. I think my dad's on Naproxen.
Yeah, so commonly prescribed anti-inflammatory for people, but actually it's even worse than ibuprofen for this intrahepatic circulation problem. So a dog converts this drug into a particular type of metabolite, which goes into the bile, goes into the gastrointestinal tract, and is reabsorbed through the gastrointestinal tract. And then it goes around the circuit again and again and again. So the half-life, what we call half-life in the amount of time it takes the drug to get out of the system, is massively extended compared to people. And so basically that the dog's organs are exposed to that drug for much longer than you would expect for a person. That's when you've actually taken into account your dog is half or a third or a quarter of your body weight and decided on an appropriate dose for it. It's still like massively overdosing him because what you don't realize is it's just hanging around in the system for ages.
Yeah. So be really, really, don't do it. Just don't do it. Okay. See the value of speaking to your vet and having a long-term plan. I'm going to come back to that with a key take-home statement. Steroids. So you said earlier, over to you, Hannah, on that one. But because in first opinion practice, I think steroids are used quite a lot for allergic skin disease, otitis externa, inflammatory bowel disease. There are a number of reasons, immune-mediated diseases. People might have an excessive amount of prednisolone, for example, kicking around. And yes, it is an anti-inflammatory. And yes, years gone past, we would have used it. Years gone past. I've been a vet for 22 years this year. And I am just on the cusp of PLT was the biggie. We had carprofen and meloxicam when I arrived. But PLT was the big tub on the shelf. And before that would have been steroids, So I wouldn't be surprised if people of the older generation, I still remember using steroids. But we've moved on from that massively now, guys. We know that they're catabolic. We know that they're
I think they have their place occasionally, usually in very severe inflammatory situations. And sometimes doing things, injecting them into joints and things like that. But generally, we don't use them as an analgesic, anti-inflammatory because of their side effects are so massive.
Yes. And what you're trying to do is not lead to all the surrounding support structures deteriorating in strength and function. With arthritis, we want to build them. And we know that steroids are catabolic. They are going to lead to lean body mass loss. So, yes, people will always say, oh, he really perked up when he was on steroids, but it's having a dramatic effect across the whole body. And it is definitely not something that we would want to employ long term. So please step away from the pot of bread that was left over from an allergic skin disease episode 3 years ago.
And if your vet has prescribed steroids for your dog, they will have been very cautious about the dose, and they will have you on a tapering regime, your dog on a tapering regime, to get him to the lowest dose that will have its effect to reduce those side effects. So your vet will have thought about it very carefully.
Definitely. Next one, and big topic across the world because of the opioid crisis. What do you feel about this? Because people do instantly, when you hear about pain, they go morphine. You know, when they hear pain, they think of opioids because they are extremely effective acute pain analgesics, surgical pain analgesics, etc. But what do we now feel with regards to using opioids? And do the little regulation speech again, just so everybody knows.
Well, before I do that, I was going to say you've put the nail on the head there about the acute surgical pain, acute trauma pain. They are not good pain relievers for long-term pain. They were originally intended for palliative care. The intention originally, allowing GPs to prescribe opioids, was for palliative care uses, and actually it's become much more that people with severe osteoarthritis and rheumatoid arthritis, things like that, are put on opioids. They become dependent on them. They get less effective over time. So, and we as vets don't like them very much because they're not very effective orally in dogs. They have a big first pass effect metabolism, where the most of the drugs taken out of the system the first time it goes through the liver, so they're not very effective orally. So yes, regulations. It's absolutely illegal to share opioids. So
illegal.
They are a Schedule 2 drug, which means they are at the highest level of regulation, apart from the classes such as LSD, which you cannot prescribe. It cannot be prescribed because they are that legal. So opioids are Schedule 2, highly regulated. If they're diverted, then hopefully the GP who's prescribing them will realise, because the person is going back for more earlier than they should, etc. But so I hope that nobody would ever give opioids to their dog deliberetely. I think most commonly we would see accidental ingestion, and a classic would be eating a opioid patch. Very, very, very dangerous.
Yeah.
So be really carefully if you are on opioids, and many people listening may well be, and it's not something you're going to suddenly come off just because some vet on the internet has said that they're not good for long-term pain. They will be being managed by your GP, so it's not. I don't want to start rocking.
I can just imagine
the patches.
Yeah, but I can also just imagine somebody on a Friday night, their dog's really lame. They've become like 9 or 10 out of 10 lame, and they look like they're really struggling, and they're trying to avoid the emergency out of hours call.
Give them a bit of Aramorph.
Yeah, and they just, please don't. It's not something that we would do. If your dog came in to see us, we'd be looking at definite alternatives to that. Now, you put other human arthritis meds.
No, you put that, Hannah.
Did I put that?
Yeah, you did put that. I think the only one that I can think of that I know enough about to talk about would be something like hydroxychloroquine for rheumatoid arthritis. It's a really narrow safety margin, so the therapeutic dose is really close to the toxic dose in dogs. It's not something we're commonly using in veterinary medicine. You are likely to give your dog a toxic dose if you try to dose it with hydroxychloroquine, so please don't. The other things like methotrexate and stuff, I really don't know anything about the way dogs metabolize it, but I'm terrified of the idea somebody might consider giving that to a dog.
Yeah,
I
do remember why I wrote that one. It's going back to the American pharmacy and seeing the range. I went into an aisle and it was joint care. And even for me, with my training, I was reading the package just going, what is in this? I have no idea. These might be supplements, they might be medications. But as you say, pretty packets, joint pain, joint inflammation, picture of a knee throbbing. And the temptation would be, oh, that looks good, that will work. Please don't, is what I'm just going to say. Please speak to your vet. Antidepressants. I think I put that there because, you know, people that are getting into more complex pain management for their dog will realize that we do use medications that are classified as antidepressants, but that takes a lot of decision making, a lot of workup, a lot of peeling the onion before we would use that. Would you agree?
Yeah, and also if your dog's on tramadol and then you decide to give it another antidepressant, you could end up with a nasty situation. Tramadol is also working a bit like an antidepressant in dogs because of its metabolites. So you can have a nasty situation if you're really unlucky called serotonin syndrome, and that can be life-threatening. So antidepressants are not to be taken lightly, and they're used appropriately by vets by prescription, but they don't work quickly either. So you need to kind of treat 6 to 8 weeks to see you get a effect. So they're definitely not a good thing to share.
No. Lynn's done a really good one. What about aspirin? And she's a cambassador, so she knows not to do this. She's doing it to try and make people think, which is great.
Yeah, again, narrow safety margin has been used in dogs cautiously in certain circumstances, but they've got a really long effect on platelets. They're anti-clotting, blood thinning effectively. And yes, I think they are quite likely to cause sort of gastric ulcers and things. So very rarely they might be used by a vet, but very rarely, definitely not to be given over the counter, because I haven't got a clue what the safe dose of aspirin is.
No.
And it certainly would be only for acute use, not for long-term use, for sure.
Perfect. I'm going to throw in a question quickly to just encourage people if they've got questions. When is the best time to seek a referral to a pain management specialist? Is it beneficial to do so at the beginning of your OA journey when there are only presenting mild signs, or during a flare, or the later stages?
I know, I think talk to your vet, because some of the vets that I speak to these days are incredibly well versed in their chronic pain management because they've done a lot of CPD on it, and they can phone for advice. So they can phone me, for example, or one of my colleagues, or Hannah, she knows lots about chronic pain now, for advice about how to treat your dog. So it doesn't have to come to a pain clinic. I think you will get a very thorough hour-long session with a specialist if you ask for a referral, who has trained specifically in pain management and in my case anaesthetics. So there are some other specialists running pain clinics who aren't anaesthetists, but have a similar level of training and certainly knowledge in pain. So you'll get a dedicated hour and then a follow-up, a letter to your vet about the ongoing management. And that is something that's difficult to get with your vet because of short consult times, etc. But start your journey on trying to look at the dog holistically and from a rehab point of view from early on, for sure. But you might be able to do that in your primary practice. And also by asking to see a physiotherapist, and then working with the vet and the physiotherapist together. So you don't have to come to a pain clinic necessarily. Not many of us. So, I'd like everyone to have access, and I think everyone can get access also by seeking advice. Their vet seeking advice, obviously with referral. So your vet can seek the advice. You can't go direct to a referral clinician for advice.
Yeah, I think it's beneficial at any point. I definitely know that more and more first opinion practices are seeing merit in setting up chronic pain clinics.
Yeah.
And they're seeing value in extending the consultation times from 15 to 30 to 45 to 60.
And also, having nurses involved in those pain clinics as well.
Yeah, definitely.
Because the nurses can do an awful lot of the follow-up and checkups and progress reports and things, and then report back to the vet.
Yeah, absolutely.
So you don't need to do that every single time.
No, exactly. Sandy North, yes. Labrello injection, sounds like mobility's improved, incontinent times. Now, that is now out on the data sheets on the SPC, isn't it? I think there is more people talking about. As an anecdotal story, there is nothing to support this. I've had a few owners that have seen merit in staying on it because the mobility's improved so much that actually incontinence starts to fade away. So I had one owner whose dog was showing some urinary incontinence, nothing on the renal values. Urine was absolutely fine. And she was like, to be honest, I'm going to put up with it because my dog's mobility is so much better. And within a few injections, it righted itself. But I don't know if they've got any studies out about that yet. I think we're going to be learning a lot more over the next few years.
Yeah, or if they even know the exact reason for that, for why it happens. I think the other thing you were saying about the incontinence fades away to nothing, I just think get a physio involved in your dog's rehab. Don't rely just on drugs. Because I reckon as your dog gets stronger because it's able to do more, if it's doing the right exercises, its core muscles improve. And what's the betting that's actually going to improve incontinence?
Yeah, absolutely. And if you're getting the pain under control, they're more willing to squat and empty their bladder rather than hanging on to it in fear of actually making that
having accidents in the night because they have held on to it.
Yeah. Right. This is a great one. Laura's amazing. What about topical anti-inflammatory gels?
They are a really, really tiny dose absorbed into the body, and then providing your dog doesn't lick it off. So you still need to be talking to your vet about that because they do thin the skin when they're used over time. So usually we're using for acute use, not for very long, often from a dermatology point of view, but they're not really going to interact with systemic medication.
No. I think it's the practicality, because I can remember speaking to a specialist years ago going, why don't we? And they were like, think about it. They're very hairy, Hannah. I was like, oh, yeah.
Oh, sorry. So you mean why not use topical anti-inflammatories to control discomfort?
Yeah.
Yeah, you'd have to keep shaving the dog.
Yeah. So I think we're so used to them, aren't we? The ibuprofen gels, the deep heat rubs and everything like that. I think things like deep heat, it feels so weird. It's so weird, but we know that we've put it there. We know there's a huge psychological acceptance. We're prepared for a sudden tingly, burny thing. Put it on a dog, they're going to be like, what the heck? So I'd be really no to that. I think that's could actually end up causing a dog quite a lot of distress, really. But the ibuprofen gels, I think it's the practicality as well, isn't it? And not being able to moderate what dose is clinically effective.
And also having a preparation that has a drug that's safe for dogs.
Yeah, well, I tell you what, I was talking to Tamara Grubb, and she was saying that over in America now, the pharmacies that reconstitute drugs into gels are just booming.
They can do anything,
Yeah, and they're doing everything and anything, but a lot of it's not being clinically trialed to be effective. Quite terrifying.
Yeah, and so many of the transcutaneous, so topical application of a drug to be absorbed systemically, so many of those trials come back as actually we could detect virtually no drug in the dog system.
Yeah.
So, so sorry, I answered that question as if we were talking about steroid creams, but we were talking about anti-inflammatories. So
No. But also I heard on the grapevine, and I don't know if it's true, getting these medications, what's the word? It's not reconstituted. It's compounded. That's it. It's not cheap either.
No.
And so people are doing it for ease of administration because their cat doesn't want the tablet.
Yeah.
The dog won't take the tablet, and they're turning these medications into topical gels, and there's just nothing to support that they're going to offer any benefit whatsoever. Which leads me on to point 12 before we conclude, because we're coming to the end. We have to also consider there's a massive fear of people going the other way and not seeking treatment at all, or using only supplements or homemade tinctures. Now, I've got something to say. The worst side effect, well, no, not the worst. It's up there as a bad side effect, is no effect. So if you've got a dog that's in pain, and you know it's in pain, and you're giving it something that you think might work, not sure. Somebody said it could do. Don't know the dose, don't know that's a side effect. You're effectively signing your dog up to potentially be left in pain, and that's not cool. Is it? So please take advice. A lot of supplements out there are very persuasive. And every time someone comes in and says, my dog's on the supplements, their pain's under control, I'm like, no. So please don't see that these things that you can buy off the shelves, the nutraceuticals, the food supplements, the supplemented diets, as pain control. They're part of the picture, but they are not the foundational analgesic pillar of
And some of them have their own side effects.
Yes. What's this? There's something called teeth protocol. Try everything else, then homeopathy. Is this better? I've never heard that before. Interesting. Apple cider vinegar is supposed to be good for human arthritis. I looked into that, and there's absolutely nothing to suggest anybody's ever tested it. There is no clinical trials to support it. And think about your body. All the men, because it was a trend, wasn't it, for a while? Lots of men were buying vats of apple cider vinegar and putting a lug of it into water and drinking it in the mornings, going, this is so good for my system. Like, what is the actual likelihood you're going to get it in your dog? But no, I've never found any evidence in the literature to support that. All right. Right. Finally, some conclusions that we came to, and I'm going to list them because we've already hit 1 hour and 5. Conclusions. Be open with your vet that times are tough, and what services can they offer you, such as maybe written prescriptions. They might allow you to compare price points. They might ask you to go and see the nurses, so you get more value out of the consultation, more time talking about lifestyle, exercise management, weight control. So please do be open with your veterinary practice. Use your nurse clinics. They're often a lot cheaper than seeing the vets, and you often get longer. And there was a clinical paper out suggesting that nurses were better at detecting pain than vets because they listen more. Us gobby types. So please do go see your vet nurses. And my final conclusion, guys, and I mean this sincerely because I've had this again and again. Short-term expense of getting it right will lead to long-term gain with regards to costs. Weight control, lifestyle adjustment, proactive meds initially will see you good rather than delay, have an amplified pain situation, multiple medications, multiple visits, multiple interventions. Acting early is way better than acting late, not only for your dog, for their welfare, but also for your price point, your availability. Right, we're at the final point. 10 top tips, quick fire, and then we're done. Number 10, I'm going to do. Number 10, weight control. I've stolen it. Number 9.
Talk to your vet or vet nurse. Sorry, that's a really easy one.
That's good. Number 8, my favourite. More rugs, less drugs.
Lovely. My next one, so what's this, number 7?
Number 7.
Beware Dr. Google.
Good one. My number 6. Consider the activities you're doing with dog. I've had many ball throwers, football kickers, stick throwers recently. And by just saying, let's rein that in, we've seen great improvements. Number 5.
Think about all of the different medications and the supplements your dog is taking when you speak to your vet, and when you don't, medicate your dog yourself.
Yeah, very good one. Number 4, we're doing an outlandish plug of a new, well, it's not new, we've had it for ages. It's called the OA booklet. It's in the member zone. You get it free of charge when you arrive. Designed like a vaccination card. It means that you can show your vet all of what you're doing, listing it down. You have a crib sheet in there, so every vet that you see has the same approach. At the back of the book, your therapist can put their findings. The good day, bad day diaries in there. The chronic pain indicator chart's there. The owner checklist is there. Get it, use it like your vaccination card throughout your journey. All pages are replaceable if you're in the member zone. Number 3.
Think about alternatives to medicines, which is kind of a bit like what you said about lifestyle changes and things. So important. You can save so much money by reducing your dog's body weight if it's overweight in the first place.
Absolutely. Number 2 for me is physiotherapy, that rehab approach. And if time is tight, see it as a chance to pick their brains. One session with them, get their take on how to manage OA, get them to teach you some techniques, some basic targeted exercises, get their advice on exercise. Amazing investment. Number 1.
Don't share prescribed medications. They're prescribed for a reason. It is not worth risking your dog's life.
Yes.
And I'm sorry, I have seen deaths.
Yeah, definitely.
Sorry to close on that remark, but it's real.
It is real. And I'm afraid I think times are going to get tougher. So take all our pieces of advice, get in with your vet practice. They're generally lovely people, but you just need to be open and be honest and say, I'm in this situation. How can we work together to get the best for my dog, which is who we care about? Thank you, Gwen, so much for your time. We are so lucky to have the lovely guests like we do. Please say thank you to Gwen for giving up her evening to come and share her knowledge and her experience. And please go and join our member zone. CAM is a self-funded initiative. We're doing this since 2017. Gwen is actually my fairy godmother. She was the very, very, very first person that ever listened to me when I wrote her an email, and I think it was 2015, saying I was interested in pain management. Can you help me? You wrote me the loveliest long email back of all these books I should buy. So thank you, Gwen. If it wasn't for you, CAM wouldn't even exist.
No, it's probably my aunt you can thank for that, because she put you onto me.
She did. Yeah, she did. Yes. So Gwen is one of my eldest friends in the pain world, and I am so grateful that she's given up her time. Thank you for saying thank you. Join our member zone, carry on supporting CAM, use our resources. We're doing the best we can to change a massive misunderstanding about how pain is managed. So please support us. Till next week. See you later.